Hemoglobin A1C is the one which gives you an idea about your average sugar. When you eat, your carbohydrate gets converted to glucose, they get into your circulation. And in your circulation, these glucose molecules get bound to your hemoglobin in your red blood cell. Remember, I told you hemoglobin pigment which carries oxygen. Also, your sugar gets bound to those hemoglobin molecules. Your red blood cells have a life of 120 days. So that's why whenever you have a hemoglobin A1C, it gives you a insight of your eating pattern in last 120 days. People not pay much attention to this test, but this is the test which will give you an average sugar test. I think this is the snapshot of your dietary pattern. Hemoglobin A1C needs to be less than 5.7, and between 5.7 and 6.4, we call it pre-diabetes. And when hemoglobin A1C increases more than 6.5, that is diabetes. Look at the charts here. If your hemoglobin A1C is 6, your sugar is 126. Anything above blood sugar consistently more than 126 is a legal definition of diabetes mellitus. So I would say this test everybody should know. And if your A1C is anything more than 5.7, you have a metabolic problem starting. If you back off, you will never see the day of having heart attack and stroke. But if you do not, you will have a problem. There is not a day when we don't get the patients who are totally oblivious. They say, I check sugar now and my sugar was 110 and you're telling me my average sugar was 240. Because I am going by this test that gives me a snapshot what's happening in last 3 months. Reverse side is, if you start doing something correctly and you come to us, we told you that you have this problem, you change your lifestyle, you start taking medication, your A1C will not change in next 10 days. It will take 120 days. Remember how the blood works? Life cycle of a red blood cell is 120 days. Whatever sugar is bound, that cell has to die, and the newer cells which are being made once your average level is low, so they will be less bound and it will take 3 months. And anything which can change the level of red blood cells, that can change your hemoglobin A1C. Thank you.